Hello again. After a gap of a couple of weeks, I thought of doing a YouTube video on my channel, Just a Talk. Hope you enjoy it and tell others and subscribe to it. The talk that I'm going to do today is about something called stem cell transplantation for the lung, COPD. The stem cells had at one time revolutionized the treatment of many diseases. However, many times they seem to have fallen short. In Florida, there used to be, or there is a institution which does stem cell for the COPD. I've seen a couple of patients who were charged $15,000, and when they came back, nothing had changed. And again, this is totally unsupported, unproved treatment. And when I came across recently a couple of articles, it was very, very interesting and very encouraging that even in end-stage COPD, chronic lung disease, which is related to smoking, stem cell type of cells can be transplanted, and that would help. So this study that I'm quoting today is a very small study, number one. And this study was reported in a very short number of people. Initially, they had tried the similar technology in mice or mouse and had seen some success to repair the injured lungs in a mouse. So they decided to do this into the human beings. There were total 28 patients. There are cells which are called p63, and these are the cells which are progenitor cells, and these are found many places. So what this study was, they had total 28 patients. At the end of the study, they had 20, and these people had end-stage COPD or stage 3, stage 4 COPD classified by GOLD guidelines. The interesting part was that they all were included in the study. 17 of them were patients that were treated, while there were control group had about 3 that were not treated with the p63 cells. They did a bronchoscopy on everybody. By brushing the epithelium from the bronchial tubes, they obtained the p63 cells. These p63 cells were isolated, and then they were regenerated or cultivated into lab for about 3 to 5 weeks. A certain volume of the cells or certain weight of the cells has to be obtained to transplant them. So they decided that once the enough volume was available, they were put back into the lungs through a bronchoscope. Now, I'm not going to go into the details of how much was the variable amount of cells that they were done. It was based on kilogram body weight, and there was a range of cells, 10 to the power 6. Once these cells were transplanted, people had baseline lung functions, and they repeated and followed these people for a total of 24 weeks. The way in which the regeneration of the alveoli or the surface where air or gas transfer occurs is to measure something called diffusion capacity for carbon monoxide. If you have an improvement in the bronchial tubes, then you will see that the flow rate, what amount of air that you can breathe out quickly in 1 second, would be increased. So that's the standard way of knowing that a drug works to improve the bronchial tube obstruction, whether it is due to inflammation or spasm of the muscles in the bronchial tubes. The standard drugs that we talk about, whether I'm going to put some generic, I'm going to put some brand names that are advertised. the Trilogy, Ellipta, the Breztri, the Advair, the Symbicort, Stiolto. All of these medications contain bronchodilators. So they basically open up the bronchial tubes, and that's how the flow limitation is improved. And when the flow limitation is improved, people don't feel that much shortness of breath. The diffusion capacity, which is we breathe in the oxygen or we breathe in the air containing 21% oxygen. This goes into the air sacs, which are like literally like grapes or sacs. And the blood vessels run around these air sacs. And the transfer of oxygen occurs from air in the alveoli to the blood as the blood oxygen pressure is low while the partial pressure of oxygen in the air sacs is high. The carbon dioxide is exactly opposite. The partial pressure of carbon dioxide is higher in the blood vessels and it is lower in the room air that we are breathing. So the carbon dioxide is transferred from blood into the alveolar air and then we exhale it. So we take in oxygen, we wash out carbon dioxide. So this process depends on alveolar or air sacs surface. It is not that much dependent though it is on airways. If the airways are constricted, certainly less air could go in and the transfer may not be as effective. But we're talking here about transfer of oxygen, carbon dioxide in the alveoli or the air sacs, and that is measured by a process called diffusion of oxygen. So we measure this diffusion, and what they found out was that at the end of 24 weeks, roughly 6 months after transplanting p63 cells, through the bronchoscope, the diffusion capacity had increased by about 18%. This is a substantial increase. In the control group, it literally dropped by same amount or a little less, but it dropped. So COPD is a disease where worsening continues to happen day by day, week by week, month by month, and the lung capacities continue to drop. So here, after doing transplant of p63 cells, the diffusion capacity improved. So they also did another test because the diffusion capacity is in-lab test. You might say that, well, what difference does it make if you're sitting in a lab and you measure certain things and they're better? What about practical aspect of walking? So we do a different test, which is called 6-minute walk test. People are asked to walk for 6 minutes while measuring their blood pressure and oxygen levels through the fingers at the oxygen saturation. And the distance is recorded at the end of 6 minutes. You are allowed or asked to walk at your own pace, but not too slow, not too fast. When they did repeat the 6-minute walk test in people who had p63 transplant cells, they noticed that the walking distance was increased substantially. If I recollect correctly, it was I think 30 meters or maybe 90 feet. So measurement in the lab of diffusion capacity, how the oxygen transfer occurs, and walking distance, which is the function or functionality, was also improved by 30 meters. So essentially the p63 cell transplant done through simple bronchoscope worked. The side effects were minimal. The only drawback is that this is a very limited study of literally 20 patients, only 17 got the transplant. But this seems like a very promising thing. Obtaining p63 cells through a bronchoscope is a very minimally invasive process. The only problem is which lab can cultivate them for 5 weeks to get enough volume that you can put it back into the lung through a bronchoscopy again. But certainly if we can show in a larger group stage 3 and stage 4 COPD patients being benefited by this simple bronchoscopy procedure, that will be worthwhile doing it. I'm hoping that more studies will be done and we will have something to talk about. Well, thank you for watching. Hope you like it. Please subscribe. Thank you. Have a nice day.